Hello, everyone, and thank you so much for taking time to be here today. I made this presentation to talk about the best coverage option that is available to Medicare beneficiaries. Listen, as we get older, whether we like it or not, our bodies age, our health starts to decline, and the wheels start falling off, as they say. So I'm here to talk about the best coverage option that's available when it comes to Medicare plans. And here's what this looks like. If you have a major health crisis, you'd end up paying little or nothing out of pocket when it comes to your medical expenses, giving you peace of mind so you can get the care that you need when you need it and focus fully on recovery so you can actually enjoy living out your golden years. Guys, the average lifespan of a human these days is 80 years old, 90 if you're lucky, and beyond that if you're extremely blessed. So we want to make sure that we're in the best position when it comes to our healthcare coverage that'll give us peace of mind and leave us with the least amount of financial exposure so we're not stressed out towards the end of our years. I'm going to be honest with you. When I first got into the insurance industry, it wasn't something that I planned for or woke up one day and said, hey, I want to be an insurance agent. It just didn't happen that way. It was an opportunity that just came and landed on my lap, and I've been doing it for the past 10 years now. At times, I personally feel like the insurance industry as a whole is a scam. That's how I genuinely feel because in a perfect world, nobody would be sick. We'd all have perfect health and perfect bodies. Nobody would have health issues, and therefore, we wouldn't need health insurance. Also, hospitals and medical facilities wouldn't exist. But unfortunately, in this world that we live in today, it's a necessity. We need health insurance to reduce the financial risks that are associated when we have problems with our health. If something happens to us and we don't have it, it can literally lead us to financial ruin. One thing I do appreciate and enjoy working in the Medicare industry is that I'm able to help senior citizens navigate the complexities of their healthcare coverage. And because I've been doing it for so many years, I know Medicare like the back of my hand. I've worked with so many different insurance companies and I know all the different plan options that are out there. So I know what's available and what's the best coverage for each person. Now, Medicare supplement plans are not for everyone. They do come with higher monthly premiums compared to the Medicare Advantage plans, but as long as you're able to afford and maintain those monthly premiums, then that's going to be the best option for you that'll give you the most comprehensive coverage. Simply put, if paying the monthly premium would take food off the table, then it's probably not going to be the right fit for you. But if the cost won't put a strain on your everyday needs, then you're in a great position to consider getting a Medicare supplement plan. I want to let you know that I'm partnered with a family operated brokerage that's been in business for over 37 years. USA Benefits Group main office is located in Spring Hill, Florida, and they have an A+ rating with the Better Business Bureau. This was all very important to me as I was looking for an agency to partner with because I wanted to align myself with a reputable organization that values integrity, longevity, and client trust. I'm very fortunate to have found them, and I work with them as a remote agent from the comfort of my home office in Boca Raton, Florida. I've decided to specialize in Medicare supplement insurance, as I said, because I believe it's the best coverage that's available out there for senior citizens. Here's a little bit about myself before we dive into the presentation. I have a strong faith in God as one of Jehovah's Witnesses, and we're known for our door-to-door Christian ministry. Here are some pictures of some friends and I at some of our spiritual events. I also do weddings once a month as a bridal makeup artist. It's always been something that I've done on the side. Being trusted by brides on their special day is such an honor. and it's just a creative outlet for me personally. This is my dog. Yes, I have a pity, and I love her to death. I got her during COVID, so she's a COVID baby and my emotional support animal. So, what is Medicare? Guys, I'm going to keep this super simple, okay? So, Medicare is health insurance that people get through the government when they turn 65. In some states, they automatically enroll you when you become eligible, but in others, you have to initiate the enrollment process by contacting Social Security Administration. One thing that a lot of people get confused about is thinking that Medicare is the same as Medicaid. It's not the same thing. Medicaid is financial assistance. It's a financial assistance program that's offered through the state for those who qualify due to low income status. All right. People literally have to be within poverty income level for them to qualify for Medicaid. And that level varies from state to state. It's not the same as Medicare. Medicare has two parts, Part A and Part B. Part A is your hospital coverage. It covers everything that's needed in case you end up staying inside of a hospital. So that includes things like your room and board, diagnostic services, laboratory tests, and surgeries. And Part B covers all outpatient services. So things like your regular doctor's visits, including specialists, preventative services, lab tests, and imaging. Basically, everything you need outside of a hospital stay is covered under Part B. When you put those parts both together, they form your original Medicare coverage. And this is the card that you get in the mail when you're officially enrolled. Please note that these do not include coverage for prescription drugs or dental and vision benefits, which we'll touch on in a little bit later. Just a side note here, guys, for more details on this, Medicare.gov is a great resource to dive into the details of all that Medicare covers. But for the sake of simplicity, this is pretty much the gist of it. Now, here are the costs associated with having original Medicare coverage in 2025. And yes, all of the following numbers change from year to year. The monthly premium for hospital Part A is $0 per month for most people. This applies to those who have worked for at least 10 years in the United States and who have paid Medicare taxes during those years. The deductible amount is $1,676, which means that if you need to stay overnight in a hospital, you have to pay $1,676 just to be admitted, even for one single day. And this is a per benefit period, meaning that when you come home from a hospital stay and then 60 days later you have to go back again for some reason, you have to pay that $1,676 again just to be admitted. And it covers you up to 60 days in a hospital. Now, if you need to stay over 60 days in the hospital, there are copays that you need to pay. For days 61 through 90, you'll pay a copay of $419 per day. For days 91 through 150, you'll pay a copay of $838 per day. And if you need to stay beyond 150 days, you're responsible for all costs. Now, guys, this coverage is not that great, okay? In fact, it's terrible if you ask me. Anyone could see how this could easily add up into the thousands with this kind of coverage in place. But don't worry, I'm going to show you the best Medicare supplement plan that you can get that will help to eliminate all of these out-of-pocket costs for a hospital stay. For Medicare Part B, the monthly premium is $185 per month for most people. This is generally the standard amount, but it could be more for people who have a higher level of income. The deductible amount is $257 per year, and this is what you'd have to pay before Medicare covers any of your medical expenses. It's a one-time per year annual deductible. Once that deductible is met, Medicare covers 80% of your medical expenses, and then you'd be responsible for the remaining 20% out of pocket. So here's a scenario of what that might look like. Let's say that a 72-year-old woman experiences a stroke at home. She's rushed to the hospital by ambulance, seen in the emergency room, and then admitted into the intensive care unit for 7 days. After that, she's transferred to a regular hospital room and stays there for an additional 10 days. During that time, she receives diagnostic imaging services such as a CT scan or MRI. She has specialist consultations, inpatient rehabilitation to help her recoup. And then after discharge, she still continues to receive care, including physical therapy, speech therapy, and in-home visits. So here's a breakdown of the costs with having original Medicare. For the ambulance ride, remember, she's not in the hospital yet. So that would be covered under Medicare Part B. So after first paying her $257 Part B deductible, Medicare would cover 80% of the cost, and then she'd be responsible for paying the remaining 20% balance. For the hospital stay, she'd end up paying her $1,676 deductible upfront. All right, that's for the hospital Part A, just to be admitted. And that covers all the services, all the costs of her services that she receives in the hospital for the duration of her stay. And because she stayed there for under 60 days, it would all be covered under that $1,676 deductible. Remember, if after 60 days has passed and she needs to come back into the hospital, she would need to pay that $1,676 again just to be admitted even for one single day. It's a per occurrence deductible. And here's where the real problem lies. It's during her recovery time. The average recovery time from having a stroke is about 3 to 6 months. So after her discharge from the hospital moving forward, she would be responsible for 20% of all her medical costs, including her physical and speech therapy sessions, along with her in-home visits. And this is all with no annual maximum out-of-pocket limits. There's no cap to the amount that she could spend on her medical costs each year. The total for one serious event, whether it's a stroke or some other major illness, can result in thousands or more out of pocket. So instead of focusing on her health and trying to recover, she's worried about how she's going to pay these bills, probably dipping into her savings in order to cover these costs, which is not the ideal situation to be in. So here are the solutions to that problem. There are two Medicare plan options to choose from that will help to reduce your out-of-pocket costs. There are the Medicare Supplement plans and the Medicare Advantage plans. The monthly premium for the Medicare Supplement plans range between $100 to $350 per month, and the Medicare Advantage plans offer low monthly premiums. You can get them for as low as $0 per month. At this point, guys, remember that I'm a Medicare supplement specialist. So although I'll touch briefly on Medicare Advantage, we will be focusing primarily on the Medicare supplement plans because they offer the most comprehensive coverage. And just a disclaimer, I have nothing against the Medicare Advantage plans. In fact, I sold those type of plans during most of my career as an insurance agent. They're a really good option for people who don't have the budget to invest in Medicare supplement plans. So it's not a one-size-fit-all solution. I'm all about living within one's means. So as long as you're able to As long as you don't feel like you're gonna break the bank trying to purchase a Medicare supplement plan, then you're in a good position to consider getting one. As I mentioned earlier, they do offer more comprehensive coverage, leaving you with less out-of-pocket expenses versus the Medicare Advantage, which often leave people with higher out-of-pocket expenses. So we're talking about higher copays and deductibles that you have to pay as you use your plan. And yes, there are some Medicare Advantage plans that offer low or no copays, but there are network restrictions, meaning that once you enroll into a Medicare Advantage plan, they take over the management of your Medicare coverage. And you're restricted to a certain network of doctors and hospitals that you can see. For example, if you join an HMO plan, you can only see doctors and hospitals that are inside that plan network. If you go outside the plan network, then you won't have coverage at all. With the PPO plans, they do give you more flexibility. There's still a network that you have to abide by, but if you want to see a doctor or hospital outside the network, then you have to pay a higher copay amount. So if you see them inside the network, it'll offer you better coverage. With the Medicare supplement plans, you don't have that problem at all. There are absolutely no networks that you have to abide by, and you're free to see any doctor or hospital nationwide. Meaning that if you want to see the best cardiologist in the country, you can fly out of your local area and still have full coverage no matter where you go. This is also great for people who have different residences in the country, or maybe you like to travel a lot. They also offer foreign travel emergency coverage as well. So with all that being said, the Medicare supplement plans are a clear winner in my book. Now, there are different types of Medicare supplement plans. Don't let this chart scare you because I'm about to break it down real simple for you. The most comprehensive plan is the Plan F, which is unfortunately no longer being offered. It was phased out in 2020. Those who already had it were grandfathered in, but moving forward, it's no longer being offered to those who are newly eligible for Medicare. The next best option is the Plan G. This plan covers everything that Medicare doesn't cover, with the exception of the Part B deductible, which is $257 per year. After that deductible is met, all of your hospital and medical expenses are covered 100% within the United States. If you travel outside the United States, then you're covered at 80% in cases of emergency. There is also the Plan N, which is the third best option. You still have to pay the Part B deductible, and you'd also be responsible for the Part B excess charges. The Part B excess charges are there are additional fees that doctors who don't accept Medicare are allowed to charge you. There are also some copays associated with the Plan N. For example, for doctor's visits, you'll pay $20 per visit, and for emergency room visits, you'll pay $50 per visit. So Plan N generally comes with a lower monthly premium compared to the Plan G, but you still have some out-of-pocket costs that will incur with this plan. That's why, as of now, the Plan G is often considered the best overall option for comprehensive coverage. And here's what that looks like. Remember this Medicare cost sheet that I showed you earlier? With the Plan G, if you need to stay in the hospital, it covers your deductible 100%. You never have to pay that. Also, if you need to stay in the hospital for more than 60 days, it also covers all your copays 100%. You still have to pay the $185 monthly premium. for Medicare Part B, this is the standard that everyone has to pay. And after you pay the $257 annual deductible, then all of your medical costs will be covered 100% by the Plan G. No copays and no coinsurance. So here's a breakdown of the monthly costs associated with the Plan G. Remember, the monthly premium for Medicare supplement coverage ranges between $100 to $350 per month. And then the Medicare Part B standard monthly premium is $185 per month. So add those both together and you'll get a price range between $285 to $535 per month. Please note that this does not include the cost of prescription drug coverage or dental and vision benefits, which we'll get into next. But overall, if you're looking for the most comprehensive medical coverage, Plan G offers the best protection available. So let's now touch on prescription drug coverage, which is Part D of Medicare, D for drugs. The Part D plans typically range from $10 to $130 per month, depending on the plan and the medications that you're currently taking. Different prescription drug plans use different tier systems. So if you're taking few or no medications, it's usually best to choose a basic plan with the lowest monthly premium to save money. However, if you take several medications, especially high cost ones like cancer or diabetes drugs, you want a plan that provides the best coverage for your specific prescriptions to help you save more money overall. So unlike the Medicare supplement plans, the prescription drug plans have an annual enrollment period each year from October 15th through December 7th. And during this time, you can switch to a higher or lower tier plan based on your current medication needs, whether you're looking to upgrade or downgrade your current drug coverage. Prescription drug coverage is optional, but if you don't enroll when you're first eligible for Medicare, you could face a late enrollment penalty later on. And this penalty is added to your monthly premium and stays with you as long as you have drug coverage. So while the amount isn't huge, it's definitely something to keep in mind. Dental and vision benefits are optional, and there's no penalty if you choose not to enroll. The monthly premiums for these plans typically range from $20 to $75 per month, depending on the level of coverage and the insurance company that's offering the plan. Now, after doing some research, I found that as we age, there are several common health challenges that many of us face. Some of the top concerns including heart disease, cancer, diabetes, arthritis, cognitive decline, and respiratory illnesses. I want to highlight a few realistic situations that can happen during our senior years and show how having Plan G, which is the most comprehensive Medicare supplement plan, can help ease the financial burden that often comes with managing these serious health conditions. Let's consider the case of Grace Yang, a 72-year-old woman living in California who needed a total hip replacement. She had been suffering from severe hip joint damage that caused debilitating pain and limited her ability to perform everyday activities. After a thorough consultation and evaluation, her doctor determined that the procedure was medically necessary. Her total medical charges included a 3-day hospital stay, the cost of the surgery itself, anesthesia, pre- and post-operative care, and follow-up visits and evaluations. Altogether, the charges came to be about $40,000. And because Miss Yang had Plan G in addition to her original Medicare coverage, her out-of-pocket expense was only $257, the Medicare Part B deductible. That's it. This is a powerful example of how comprehensive coverage through Plan G can significantly reduce the financial burden of major medical events. Let's meet Andre Williams, a 75-year-old man living in the state of Georgia. During a family gathering, Andre began experiencing severe chest pain and was rushed to the hospital where he was diagnosed with acute heart failure. After being stabilized and undergoing emergency diagnostic tests, doctors determined that it was medically necessary for him to be transported by air ambulance to the Cleveland Clinic in Ohio, where specialists could perform a complex heart valve surgery. Following the stressful procedure, Andre received post-operative rehabilitation and made a strong recovery, all with a peace of mind, knowing that his medical expenses were fully covered. His total medical charges amounted to $91,900, nearly $100,000. But thanks to having Plan G alongside his original Medicare, Andre's out-of-pocket cost was just $257, the standard Medicare Part B deductible. That's the power of comprehensive medical coverage. Lastly, let's look at Madison Clark, a 68-year-old woman from Arizona who was diagnosed with stage 2 breast cancer and began a comprehensive treatment journey. Her care included diagnostic imaging and a biopsy, followed by lumpectomy surgery and a hospital stay. After surgery, she underwent 5 weeks of outpatient radiation therapy and 6 rounds of chemotherapy infusions, along with regular visits to oncologists, lab work, and follow-up imaging. Her total medical expenses exceeded $60,000. But thanks to her Medigap Plan G, the only out-of-pocket cost she faced was the $257 Medicare Part B deductible. During such a challenging time, Madison had the comfort of knowing that she was in very good hands when it came to her medical coverage. Now, here's an important question. When should I enroll? If you're turning 65, this is your one-time chance to get a Medicare supplement plan without any health questions. Miss this window and you might not qualify later. The best time to enroll is during your Medigap open enrollment period, which starts the first day of the month you enroll into Medicare Part B, and you must be 65 and older. This enrollment period lasts for 6 months. And again, even if you have all the top health issues that a person can get, the insurance companies cannot deny you coverage. You could still enroll outside of the 6-month period. There's no annual enrollment period that you have to wait for to sign up for a Medicare supplement plan. You can sign up at any time during the year, but you might be subject to medical underwriting. Because of this, you can either be given a higher rate or you could be denied coverage altogether based on your health status. There are also other special enrollment situations that you can enroll without medical underwriting, like if you lost your employer group health coverage, or if your current Medicare Advantage plan exits the market, or if you move outside of your plan's area. Those are all special enrollment situations. But while these situations allow you to enroll without answering any health questions, they are relatively rare. So it's best to take advantage of your initial Medigap enrollment period when you first turn 65 and enroll in Part B. Those who are under 65 and have Medicare due to a disability are not eligible for a Medicare supplement plan. So to further illustrate this for you guys, because this is very important if you're considering getting a Medicare supplement plan, here's what your Medigap open enrollment period looks like. It starts the first day of the month you enroll in Medicare Part B, and you must be 65 or older. The enrollment period lasts for a period of 6 months, and it's a one-time enrollment period that does not repeat every year. So let's say, for example, your Part B is effective October 1st, and you're 65. October is going to be your first month. And then there's November, December, January, February, March. March is your last month to enroll into a Medicare Supplement plan with no health questions asked. You pretty much just apply, pay your monthly premiums, and you're all set. And just to clarify, you do need both Part A and Part B of Medicare to join a Medicare Supplement plan. Now, as a licensed insurance broker, that means that I'm not bound to one insurance company. I have no interest in advocating for one company over another. In fact, I'm contracted with several insurance companies in order to look out for the interests of the clients that I serve. And here's one thing. The Medicare supplement plans are standardized through the federal government, which means that if you shop around to several companies that offer the Plan G, for example, you will see that the benefits are exactly the same, regardless of which company you're looking at. The only difference is the monthly premiums that those different companies charge. So my goal in a situation like that would be to match you with the company that offers the Plan G at the lowest rate in your area. Another important factor to consider besides the monthly premium is the financial strength of the company you choose. It's essential to go with a carrier that has a solid financial rating to ensure stability and reliability over the long term. I only work with companies that have strong financial ratings, and I'm currently contracted with several top-rated carriers. I'm also licensed to sell Medicare supplement plans in multiple states across the country. To see the most up-to-date list of states where I'm licensed, you can visit my Facebook or Instagram page to check if I'm licensed in your state. That wraps up my presentation, guys. I hope you found the information super helpful. If you're considering a Medicare supplement plan and you feel ready to enroll, you can book your free enrollment consultation using any of the links below. If you found me on Facebook, just tap the calendar booking link on my page. If you're coming from Instagram, click the link in my bio to schedule your appointment. And if you're watching from YouTube, check the video description for the booking link. If you have any questions, feel free to call or text my work number displayed on the screen. I do have regular office hours, so I'll respond within that time frame. You can also email me or send me a DM on any of my social media platforms. I look forward to connecting with you guys soon and have a blessed day.